Hi friends, this is Dr. Anugraha here. So today's topic is diagnosis of diabetes mellitus. It's a very simple topic, just have to mug up some numbers and then we'll do an MCQ. Alright, so see, in a normal person, when we talk about diagnosing diabetes mellitus, you will have to know about what are the normal values in a fasting blood glucose, postprandial blood glucose and HbA1c. In a normal person, what are these values? First, you should know that. Then we'll talk about how these values change in a diabetic patient. See, normally, fasting blood glucose should be less than 100. Okay, and PPBS, what is that? Postprandial blood sugar. You ask the patient to eat something and after 2 hours you check the blood sugar. That is postprandial blood sugar. So here, in a normal person, it should be less than 200. Okay, and HbA1c in a normal person should be less than 5.6. Simple, no? 5.6%. Now, in case of diabetes mellitus, fasting blood sugar. Fasting means after 8 hours of fast. In a diabetic patient, fasting blood glucose level will be more than 126. Okay, PPBS will be more than 200 and HbA1c will be more than, you just switch the numbers. In a normal person, it is less than 5.6. When it's diabetes, you switch the numbers. It will be more than 6.5%. Simple. Now, see, before we do this MCQ, just know that we have a guideline called as American Diabetes Association Guidelines. We follow this guideline to diagnose a patient as diabetes. Okay, so see, under this guideline, more or less it is the same. They have got these 3 criteria and one more extra. Okay, so under ADA guidelines, they have got fasting blood glucose level. If it is more than 126, if HbA1c is more than 6.5%, and if 2-hour plasma glucose, see in ADA guidelines, no, it's actually not postprandial blood sugar what they take into consideration. In ADA, what they check is 2-hour plasma glucose after OGTT. What is OGTT? Oral glucose tolerance test. They give 75 grams of oral glucose and then check how the glucose level has gone up. Okay, that is 2-hour plasma glucose level after OGTT. So that is the next criteria under ADA, and if that is more than 200, okay, and then one extra criteria is there under ADA guidelines, that is random plasma glucose if it is more than 200. All right, if out of these 4, if at least 2 criteria are met, then we label the patient as diabetes mellitus. All right, so at least you remember these values, the first table that I've got in front of you. These values you remember, so you can easily track the question. Okay, it's okay if you don't. I don't think they'll ask in specific the ADA guidelines, but it's good to know. Okay, we'll read the question. A 45-year-old man presents with he comes for routine health checkup. He is asymptomatic. See, his fasting blood glucose is 132 mg per dl. That means what? Fasting is normal fasting blood glucose level is how much, dear? It should be, it should be less than 100. Now, if it is more than 126, then if it is more than 126, we label him as diabetes. Okay, so you got your answer. His fasting blood glucose level is 132 mg per dl and HbA1c is 6.8%. Again, say it is a clear indication that he is diabetic. The question is, what is the next best step? Repeat fasting blood glucose to confirm the diabetes, start metformin, do an oral glucose tolerance test, diagnose diabetes mellitus. Actually the best answer here is you diagnose. See, under ADA guidelines, I told you if at least 2 criteria are met, you label the patient as diabetes mellitus. So the best answer here is you diagnose him as diabetes mellitus. All right, fine. So yeah, let's call it a day. I'll see you later. Bye bye. Have a good day. Bye.